Hello and welcome to Kind Party. Today I'm going to be talking about some non-clinical healthcare jobs that can actually allow you to work in the hospital with little or no experience. With these jobs, you can actually get into the hospital and understand how the hospital functions. From there, you can pursue your career. And most of these jobs, actually allow you to work without having access to the patients. So you'll be working in the background, and it doesn't matter. It doesn't matter where you're working in the hospital. Everyone in the hospital, from the biomedical engineers, from the engineering department, from the IT, we all come together to make sure that the patient has utmost and the best care in the hospital. Therefore, it doesn't matter where you work in the hospital, you are also contributing to patient care. Some of these jobs are very good and they actually pay well. And if you work hard and if you get into the industry, from there you can learn and grow further. Most of these jobs actually require little or no experience. Therefore, these jobs are open for everyone, from supply chain to transportation to admin services. These are all jobs found in the hospital. When people think about the hospital, they only think about the nurses and the doctors. But they forget to understand that even patients in the hospital are supposed to eat. Therefore, there's a hospitality department. Even patients in the hospital are supposed to move from place to place. Therefore, there's a transportation department. Every hospital has supplies. It's supposed to use consumables. Who are those transporting? Who are those purchasing? So there's a supply chain department that takes care of all of this. There's an admin department, from the human resource department to marketing and all that. These are all jobs found in the healthcare industry. And most of these jobs actually require little or no experience. The first job that I'm going to talk about is a ward clerk. A ward clerk in different countries can also be called a unit secretary. And ward clerks are not only limited to the inpatient department, they are also found in the outpatient department. So you call them OPD clerks or outpatient department clerks. Ward clerks are actually people in the unit that are part of the administration, part of the admin team. Therefore, their function is sometimes, depending on the hospital, they are limited to administrative work, the paperwork in the unit. You can find ward clerks in actually the ICU, in the emergency department, in the surgical ward, in the medical ward, in the NICU, in the PICU, in different departments in the hospital. And you can find them again in the outpatient department. They can either be attached to a specific doctor, like a cardiothoracic surgeon, or they can control an outpatient department. Their duties actually differ in different departments. Sometimes they can take care of discharge and admission of patients, and sometimes they can take charge of consumables in the unit. Salary range for ward clerks in the United Arab Emirates actually range from 4,000 to about 6,000 or 8,000. Getting a job as a ward clerk actually allows you to work in a unit, either in the inpatient unit, in the inpatient department, or in the outpatient department. If you're working in the inpatient department, it helps you because you actually be able to see how the inpatient department functions. You will be able to see how the nurses are taking care of patients. From there, you can learn so many things. I'll actually advise that if you are a nurse, if you are planning to become a nurse, or if you are schooling already, or a nursing assistant, a ward clerk position is a very good one for you because you'll be able to actually work in a unit and you actually see how the unit functions. You get more experience, and from there you can actually push forward with your career. The next job that I'm going to talk about is a patient administrator or a medical receptionist. Depending on the hospital, some hospitals call them medical receptionists, some call them as patient administrators, and they have other names also. However, they all have almost the same function. A patient administrator is that person that when you come to a hospital or when you come to an outpatient setting in a hospital, you will meet them at the reception. When you meet them, they'll be the one to check your information, to check your insurance if it's valid, and your eligibility. They'll actually be the one to admit you into the unit. From the registration process, they'll check your insurance and they'll actually do the billing. So these are people that are part of the administrative team, and they mostly work in the outpatient department. Their salary range is actually between 6,000 to about 8,000 or to 10,000 depending on the hospital that you work for. I actually require little or no experience in this job. All you have to do is make sure you have great communication skills and be able to learn very fast, because you actually have softwares that you can use and you will be trained to use these softwares. These softwares can be softwares like SAP or the track care system. The next job that I'm going to talk about is a general assistant. These are general assistants or transporters. A general assistant, as the name implies, is someone who is involved in assisting the nurses in the unit. So a general assistant can actually be found in the inpatient department, like in the ICU. Their function in the ICU will actually require them to help with patient care, like turning and positioning of patients, transferring patients from the ICU maybe to the CT scan or the X-ray. They can also be involved in pharmacy runs. They can help to get medication from the pharmacy when the nurses are busy, and they can do a lot of stuff in the unit. In the outpatient area, a general assistant can actually be someone in the hospital who is involved with assisting patients from one area in the hospital to another. There are patients who come to the hospital alone with on wheelchairs. So when they come on wheelchairs, there's someone who is supposed to help them to transport them, maybe from the radiology department to the emergency department or to the cardiology department. Therefore, general assistants are very, very important in the unit or in a hospital, and their salary range is sometimes between 3,000 dirhams to about 5,000 dirhams. The next job that I'm going to talk about is call center agents. In every hospital, there are call center agents. The function of call center agents, as you already know, they are involved in answering calls in the hospital. This can be external calls from patients who are asking for information regarding a specific doctor or a specific service in the hospital. And call center agents can also be available inside the hospital to help to transmit information within the hospital. In every hospital, there are codes. So there's someone who is supposed to transmit these codes to the hospital. In case there's a code white, which is maybe violence. In case there's a code red, which might be fire. There's someone who is supposed to be there to transmit these codes. So you are supposed to be you are supposed to be good in communication and be calm at every moment. Call center agents require little or no experience, but you actually need to be someone who has good communication skills. Their salary range is also between 4,000 to about 6,000 dirhams, depending on the hospital you work for. The next job that I'm going to talk about are people in the supply chain. These are stores coordinators or consumables officers. In every hospital, they are supposed to use consumables, from the syringes, the gloves, the fluids that they use in the hospital. How do they get there? These items get to the hospital because there's someone who made a purchase. So because there's a supply team and there's a transportation team. So in every hospital you go to, there's a stores department, there's a consumables department, and there's a consumables officer. He's the one that coordinates quantity that comes into the hospital and distributes to all the units. Together with the stores coordinator, they make sure that every unit has the specific supplies that they have ordered. So a stores coordinator can make salaries from 4,000 to about 6,000, while a consumables officer is supposed to make salaries from about 6,000 to about 10,000 dirham or more, depending on the organization. Therefore, this is a good opportunity for someone who has experience in the supply chain to work in the healthcare industry. You can work in the stores department. You can work as a stores coordinator, a stores assistant, or a consumables officer. All these jobs are available in the hospital. The next job that we are going to talk about are the drivers and transporters. Just like we had those who can transport patients from one department to another, we also have people who are supposed to transport consumables from one hospital to another, or from a supplier to the hospital. And these are the drivers in the hospital. Every hospital has a transport team. Drivers are not only limited to transporting consumables. You can actually work in the ambulance department, the ambulatory care, transporting patients also. So drivers are needed in the ambulatory care, and drivers are needed in the supply chain. And not only that, drivers are also needed within the hospital, because some hospitals have these mini carts that are supposed to transport patients from one place to another. So if you are someone who loves driving, if you are a driver with a license, you can actually apply for these jobs in the hospital. And their salaries always range from 4,000 to 6,000 or more. The next job I'm going to talk about is a medical coder. A medical coder is actually someone who analyzes clinical statements and assign codes to them using actually a classification system. So they actually get a service. Maybe a service has been rendered to a patient. Maybe a CT scan. Maybe an X-ray has been performed on the patient. They are supposed to convert this service to a code that will help the billers. The salary range is between 5,000 to about 8,000 dirham. The next job that I'm going to talk about is regarding people in the hospitality industry. When patients come to the hospital, especially in the inpatient departments, during their stay in the hospital, they are supposed to eat. So who prepares their food? That's why every hospital has cooks or a chef working together with the dietitians and the doctors. They prepare meals for the patients. Therefore, if you are someone who works in the hospitality industry, this is a good fit for you. Actually work in the hospital as a cook, preparing meals for patients in the kitchen. And after preparing these meals are supposed to be taken to the patient rooms. That is where servers, or what we call waiters and waitresses, they come in. In the hospital setting, we will not call them waiters and waitresses because that is not a restaurant. You can call them servers. They actually work in the hospital, and their job is to take food from the kitchen to the patient rooms. When they deliver this food to the patient, depending on the time frame, they come back to collect their dishes and dispose them. So if you're someone who works in the hospitality industry, either as a waiter or a waitress, or you work in the kitchen, or you like jobs in the kitchen, so there are so many jobs, also the same job that you see in the restaurant for people as waiters or waitresses or as chefs, you can actually have those same jobs in the hospital, because there are people working in the hospital preparing food for patients daily. And salary range is really very good. If you are directly employed by the hospital, you receive good salaries. However, if you are working with a third-party company that has been called upon by the hospital, the salaries might be low. The next part I'm going to talk about are the housekeepers. These are those into the housekeeping. These are those people in the housekeeping department. So if you're working also in the hospitality industry, if you're a housekeeping manager, there are jobs in the hospital for you. One of the most important departments in the hospital is the housekeeping department. This department does not only take care of the patient rooms, they also make sure to disinfect every area in the hospital, thereby preventing the spread of infections. Therefore, if you're someone who is in the housekeeping department, you can actually apply for these jobs in the hospital. You can apply as a housekeeping manager, or a housekeeping coordinator, or a housekeeper. These jobs are available in the hospital. All these jobs I'm talking about, from the ward clerks to the medical billers to the patient administrators, you actually have to get some knowledge in computing. That's why it's very important to be comfortable with the mouse, because even if you don't know the software that they are using, when you get into the hospital, you'll be trained. For example, for the patient administrators, you'll be trained on using the track care system, if that hospital is using the track care system. For a ward clerk, for a stores coordinator, if you are using SAP in that hospital, when you are employed, you'll be trained on how to use SAP to do the purchase requisitions, to do the good issue notes, and to do every other thing they are supposed to do with the SAP. If you are a general assistant, you will be offered, in some good hospitals, you'll be offered a free BLS course, a basic life support course. Because if you work in the inpatient unit, of course, you're supposed to have some knowledge in basic life support. So these hospitals will actually offer you free BLS courses and ACLS courses, because you need them. You need these courses. So try to always search. Don't focus only on becoming a nurse. Don't focus only on becoming something else. There are actually many different opportunities like this in the hospital. And today I just decided to talk about these ones, because these are entry-level jobs that you can actually enter into these jobs without any experience at all. And there are different jobs in the hospital. that are actually very, very high paying jobs, and I'll talk about them in the next video. Remember, there are many departments in every hospital. If you're an engineer, if you're a technician, you can work in the engineering department. If you're a technician, you can work in the engineering department, or in the biomedical department, or in the IT sector. If you're someone in marketing, there's a marketing department. Administrative knowledge, you can work in the human resource department or in the corporate team. There are so many opportunities in the hospital. Always try to search and make sure you apply for these jobs, because these jobs are in high demand in all hospitals. Thank you, and if you find this really nice, if you find this helpful, please try to subscribe and promote the channel, and kindly leave a comment and tell me what you want me to talk about next. I'm here always, and remember, this is Kind Party with love.